Transparent AI predicts breast cancer. Up to 5 years in advance, a groundbreaking artificial intelligence AI system, ASIMRI, is now capable of predicting breast cancer up to 5 years before it develops, with notable accuracy. Unlike previous AI models, ASIMRI is transparent in its decision-making process, allowing us to understand how it generates predictions. ASIMRI focuses on comparing differences between the right and left breasts, streamlining earlier models, and offering a more straightforward method for assessing risk. According to its creators, this innovation could save lives, reduce unnecessary testing, and lower healthcare costs. Traditional AI gives an answer without explaining how it arrives at that conclusion, creating a black box problem, explained John Donnelly, a PhD student at Duke University and lead author of a recent paper on the model published in Radiology. With ASIMRI, the decision-making process is clear, allowing for verification and greater trust. Breast cancer affects 1 in 8 women, with 1 in 39 dying from the disease. Mammograms currently miss about 20% of cases. This issue has gained recent attention, notably when actress Olivia Munn was diagnosed with an aggressive form of breast cancer despite a clear mammogram and a negative genetic test. ASIMRI has the potential to make AI more accessible and trustworthy in healthcare, said Dr. Viviane Freitas, a radiologist and assistant professor at the University of Toronto. This represents a new era for AI, Freitas stated in an editorial, emphasizing the system's ability to improve acceptance of AI in medical practice by making it more comprehensible. AI as a valuable diagnostic tool. Donnelly described ASIMRI as a simplified and more transparent iteration of MRI, a groundbreaking AI model introduced in 2021. MRI's original promise was to accurately predict breast cancer risk over the next 5 years, outperforming conventional risk calculators like the Tyrer-Cuzick model. MRI could identify up to twice as many future cancer cases compared to traditional methods and maintained accuracy across a diverse range of patients, addressing common issues in both AI and healthcare, where minority groups often experience lower accuracy and poorer outcomes. Traditional models like Tyrer-Cuzick rely on personal and family history to assess risk statistically, but MRI takes a more advanced approach. It analyzes detailed data from mammograms, identifying subtle patterns that may go unnoticed by the human eye. 4 images, 2 from each breast, are fed into the model, producing a risk score between 0 and 1 for the likelihood of developing breast cancer within 1, 3, or 5 years. ASIMRI's transparent, data-driven approach marks a significant step forward in AI's integration into medical diagnostics. Study co-author Dr. Fides Schwartz, a radiologist at Brigham and Women's Hospital in Boston, explained that researchers eventually cracked the code of MRI's black box. ASIMRI performed nearly as well as MRI, identifying higher risk in patients who would go on to develop breast cancer 66% of the time, compared to MRI's 71%. In cases where ASIMRI detected persistent asymmetry over multiple years, it performed even better, assigning higher risk to future cancer patients 88% of the time. We found that with surprisingly high accuracy, we can predict whether a woman will develop cancer within the next 1 to 5 years, based solely on localized differences between her left and right breast tissue, said John Donnelly, one of the lead researchers. Patients with higher risk scores might undergo more frequent screenings, have mammograms supplemented with MRI scans, or receive closer monitoring of areas flagged by the AI model. For those with very low risk, we might even be able to skip annual exams that are uncomfortable and perhaps unnecessary, Schwartz added. Robert Smith, PhD, Senior Vice President of Early Cancer Detection at the American Cancer Society, noted that AI has been employed for years in attempts to reduce radiologists' workloads and improve diagnostic accuracy. AI has never quite lived up to its full potential, Smith explained. Often, inexperienced radiologists would lean on AI too heavily, allowing it to handle most of the interpretation. Unfortunately, that just wasn't accurate enough. Smith remains hopeful about the next generation of AI models, with around 18 to 20 currently in development. These innovations have the potential to save lives, especially in regions with a shortage of radiologists. However, he cautioned that it will take time before doctors or their patients are comfortable deferring mammograms based solely on AI-generated predictions. "We're just not there yet," Smith concluded.